For definitely, for sure. And I really appreciate that perspective, and something that, I know that you are advocating for, and that hopefully we can, be helpful in changing some of that for the future. And that's part of my passion with this topic, is like helping counseling students be aware of this as, an issue. And if they're interested or have some family experience, like learning more. And I just really appreciate that your advocacy and your willingness to partner with me in this process. Just to kind of move forward a little bit, I wonder if you could talk a little bit. I heard you say, all the aftermath, like, so I think from our conversations, I've heard that a lot of people are like, okay, yay, organ transplant, you're good. That's such a wonderful thing. And it is a wonderful thing.
Yes.
But can you talk a little bit more about, okay, the part of the process that happens, you're in the hospital, you get the transplant, then what happens?
And no fault of their own of people that aren't exposed to organ donation. I'll tell them, they'll learn that I'm a transplant recipient, and exactly, they're like, oh, congratulations, so you're good now. Sometimes you just have to kind of smile and be like, okay, you'll keep it short and, nod your head. There's so much work that goes into it. There's so much joy and appreciation, though. You get this totally different perspective on life of gratitude. And that has been such a blessing and just amazing part of the journey. But it's a daily work. You're now an immunosuppressed person. For me, I take around 20 pills a day. After my transplant, I took around 40. Your decisions and how you live your life and how you respond to illness with the suppressed immune system is totally different. So the person you were pre-transplant, you're a different person. There's, of course, good things to it, and there's hard things to it. And it's, for some people, they get a transplant and almost don't know what to do. It's like a now what? I feel like there's so much support needed after transplant for people to learn how to integrate back into their lives, almost as a bit of a healthier version of themselves too. I think sometimes people get used to dialysis and being so sick, and you get the transplant, of course, it's a healing process. It's a big surgery. And then once you recover from that, you're a new you. And it's like, now what do you do with your life? And I think a lot of times it's hard to connect with others because your life is different. You have to make different decisions with a suppressed immune system. You have all your doctor's appointments, your labs. The conversations almost feel different that you have with other people. And for me, it's been hard to connect, and friendships have been hard ever since childhood because I've always felt a bit different and been hard to connect with others that aren't going through the same journey as myself.
I really appreciate that perspective. And I know we talked a little bit about some of the term ambiguous grief and how it's like, you're so thankful that, on one hand, and on the other hand, there's pieces of you that are really different now. And on the outside to other people, they don't often recognize that.
Yeah.
So I appreciate you giving voice to that.
Yeah, I think that a lot of times transplant recipients feel guilty to express anything that they actually have to endure that could be considered a challenge or hard on them, because you're given a second chance and they feel like all they should express to the world is gratitude. And it is. I mean, I'm like bursting with gratitude to still be alive today, thanks to two selfless people saying yes to organ donation. But I think recipients need a space to be able to be open about the challenges and the hardships of this journey in order for them to be able to move forward and live a healthy and productive life.
Well, and speaking of hardships, can you speak a little bit about what it's like to be an organ transplant recipient during COVID?
It has been quite challenging. I have trouble with any type of risk. I think a lot right now, every decision is risk versus benefit. I'm so grateful for my stable health. When COVID started, I was only a year and a half post liver transplant, and I started to feel myself again in this wonderful version of myself that I didn't even know would happen, but it did thanks to receiving my transplant. And I don't want to do anything to jeopardize that. So I really struggle with bringing in any risk. So my husband and I have lived just super careful. We don't have any children, so it's just the two of us, and I'm able to stay home and do my work. And he goes into the office, he runs our errands. I mean, we're just living quite secluded. I struggle with doing anything to jeopardize my good health because I respect my donors. And it's been so nice to have that fear of death lifted off of my shoulders that I had so long before my second transplant. And it's just been really tough to see how others are living in the world and lack of empathy and feeling a bit just not able to connect with others. And, you know, a little bit into COVID, it was like, yeah, you should stay home. Totally, you should stay home because you're immunosuppressed, but I shouldn't stay home because I'm healthy and go live your life. So I feel like my husband and I have felt even more separated from others now, emotionally too, in addition to physically, because of how we have to live our lives different. And we have to be responsible when receiving an organ transplant, because for us, a fever is a trip to the emergency room, even before COVID. And, you know, if you get sick, it's throwing up immediately emergency room because you're not keeping your medicine down. So just the choices that you have to make, even outside of a pandemic, is just different. And it's just been really hard for me personally, it's been really hard to be the healthiest I've been in years and have to remain secluded because I strive to live the most fulfilling life I can to honor my donors. And I'm looking forward to when I can feel more comfortable and safer in this world, which I'm sure many others feel the same way too.
Thanks for sharing. I know it's been a hard journey. I think, you know, what would be a couple of things that you think would be maybe the most important for a counselor that you would say if you were coming to one of my classes, like you really want to think about this or the impact of this or an impact of that when working with someone who's dealing with a chronic illness that leads to organ transplantation?
With having a genetic disease, I definitely want to share the dynamics of having a family disease, as I say, polycystic kidney disease is, because I have seen how it has impacted all of my family differently. How I respond to it is different than my brother, who lives in denial. My mom has lived with guilt and fear and sadness basically her whole life. And the wild thing is that she's 65 and doing so well with the disease, hasn't needed dialysis or transplant. And when she was diagnosed in her early 20s, she lived in fear her whole life that she was going to get sick any minute, which shows, it just makes me so sad that that's how she lived, because she didn't need to, although I understand it. So she hasn't physically gone through the disease, but she has emotionally, watching family members die and her own children endure it. So it's so important, if you are introduced and around somebody that has a family disease, to really try and understand the big picture and how not one of us have been impacted the same in our family. I think with someone growing up, a young person with a chronic illness, the switch from adolescence to adulthood and care is really important to give support to and try and understand that. Growing up, I had my mom and dad that would speak at appointments and support me. And then all of a sudden I received my kidney transplant at that pivotal care mark from pediatric to adult care. And me trying to switch and become my own advocate and realize that I needed to understand my medicine and what I was taking, and that it was my job and not my parents' job. And that switch for me, there was one moment that just clicked in my journey, and it was so empowering, like to realize that I can do this on my own. I need to do this on my own. And then me being an advocate for myself switched to me wanting to be an advocate for everyone else that I can, and to change that perspective. And I think for those that are going through organ transplant, I think it's important to understand that there's different phases of it. It's not just one thing. You know, with an organ transplant, it usually comes with a diagnosis of something, and that's huge. Then you go to the living in the trenches of this diagnosis, of the symptoms and the day-to-day, and then you go through the pre-transplant evaluation, which is huge. Then just the surgery itself, like this whole moment leading up to this gigantic moment, the fear and emotions of if you're going to get the transplant. And then for people that endure emotions surrounding if they receive it from a deceased donor too. That's another thing that some people struggle with. And then you have post-transplant life, which is a whole new you, which can be beautiful. It can be an amazing journey, but for some people it can be hard to, I think, find themselves and figure out what they want to do with their lives. This is a community that needs so much support, and it's not just a one-day event. There's so much to it, so many lives impacted. And I think the attention to also to the caregiver as part of the journey is really huge too, because they are greatly impacted. They're the ones that are there day in and day out, and they need just as much support as the patients do themselves.
Thank you so much. I don't know why my audio keeps doing that, but I think your passion is evident in your voice and your nonverbals. And I just am so appreciative of you being a part, and look forward to doing other presentations with you and helping to share the word about organ transplantation and the support that is needed, and also the what we can learn from recipients and caregivers, that can be very helpful to our own processes in life. Just a couple of things to finish out our session. Valen has I guess I don't have a way to put up your website right in this moment, but she has a website. If you're interested in learning more about her, you could Google Valen Keefer, and I'll give it out at the session so that they can have it. You can learn more about her. She didn't say all of this, but she's actually speaks nationwide and is really involved in the organ transplant in the polycystic kidney disease community. And I know that as she's speaking, you could probably hear how much work it is to be an organ transplant recipient, and to live with a chronic illness. And we both want to just acknowledge that we note that we have like a lot of privilege in like having access to healthcare, having access to supportive family and friends, and that we both are wanting to advocate for all those individuals that are on the lists or going through this process that don't have that same those same privileges, because they're just as valuable as others. And I'm thankful for Valen's voice in this area. So thank you so much, Valen, and I hope you have a wonderful day. And then I'll just turn my recording off and get back to like chatting with everybody that showed up today for our session. So you want to say bye?
Thank you so much, everyone. I wish that I could be there with you, and I appreciate you listening to my story. And Cristen, I'm grateful for you affording me this platform today.
Great. Thank you.